What are your opinions as to whether Obamacare should be repealed, and if so, should it be replaced?
My very first vote in Congress was to vote to repeal Obamacare. I have voted about 32 times to either repeal or defund Obamacare. One of my most disappointing days was when I was sitting at my desk and the highest court in this land said that the Affordable Health Care Act, Obamacare, was constitutional because it was a tax. That was a farce then, and it's a farce now. This law is bad policy. Yes, it raids Medicare at a time when we can no longer raid Medicare. Medicare is going broke, $700 billion. But fundamentally, it's wrong. This was a bill that was put out there and crammed down the throats of the American people in a previous Congress. They said we had to pass the bill to find out what was in it. When Nancy Pelosi said that, I said, no, she can't be saying that. That's what she said, and that's what she meant. The American people are finding out what's in it, and it's not good. It's not good for businesses. It's not good for the states. It's not good for health care. It's not good for consumers. It's not good for senior citizens. It has got to go. And it is my fervent hope that when we elect Mitt Romney and Paul Ryan, get a Republican Senate, send me back to the House of Representatives, which we will keep in strong Republican hands, that we will repeal it and send it back and get real health care reform in this country that takes everything into account with free market solutions is what we need. Thank you.
The Affordable Care Act is a very good act. The Tennessee Medical Association has come out in support of that act. It has too many long overdue insurance reforms. Yes, he has voted 32 times at great expense to repeal the Affordable Care Act. When you ask people about the Affordable Care Act, they like that there is no longer an exclusion for a pre-existing illness. As a physician, I have had a patient who goes into the hospital, has a heart murmur, gets a valve replacement, had their pre-certification from their insurance company to have that done, and while they were in the hospital, the insurance agent came in and said, we changed our mind. This is a pre-existing illness. You're not covered. Just to weasel out of paying for what they had already pre-certified to be done. And that has happened over and over and over again. For those of you who think that this is a bad bill, look at the provisions. The children who, all the way up as adults to age 26, can stay on the plan. Look at the 212 average dollars in savings to the Medicare recipients. There is not a $716 billion rate. They had an experimental program to try to get managed health care in Medicare and see if the insurance companies could get that to work at a lower amount. And the insurance companies just kept charging more. So part of that $716 billion is we're not going to overpay the insurance companies anymore. The other part is that once people have the Affordable Care Act coverage, they are not going to need to pay the disproportionate funds to the hospitals for poverty care. There's nothing pulled out of Medicare. What's going to be pulled out of Medicare will happen if the Ryan budget goes through and you have a voucher program. That will annihilate Medicare as we know it. It will take away the community rating type plan that we have. So the Affordable Care Act is excellent.